Okay, so two things. I need everybody to look at me, okay? So you have transvaginal and you have transperineal. Okay, so I'm gonna show you how to put the gels on. Let me get some gel. Forgot my gel.
She's still, no, she didn't finish it. She's still talking about chapter 1. This is chapter 1.
But you already gave us the
Okay, so transvaginal. I need an empty bladder because if you don't, the ultrasound, the bladder takes up the whole image. There's no room for your uterus or your babies. And on top of that, it causes artifacts. Okay? So you put gel inside the condom. Okay? You put your transducer on it and you roll it down. Most places will have like a rubber band to secure it with. It's your job to go like this and get rid of the air bubbles. Because if you have an air bubble, then it's going to stop this ultrasound from going in. Every transducer is different. If you have a question, just touch the leading edge, and that will tell you how you hold the transducer. A transducer is held like this and like this. This is sagittal, left, right, anterior, posterior. Okay? Transvaginal. This is coronal, but we call it transverse. Anterior, posterior, left, right. And then if you want to see, you have to go superior, inferior, superior, inferior, superior, inferior to see it all. Okay? Like when we teach you how to do this, when you go to the ovaries, it'll be superior ovary, mid ovary, with and without measurements, with and without color, and transverse. Those are going to be the things. Okay. Transperineal. Transperineal is mostly used for women that are not sexually active, or should I say, never sexually active. So they're virgins. We're not going to put a transducer in there if they tell us that they are a virgin. Okay? So because there are cultures out there that if we break their hymen, they will never be able to get married. Okay? Because when their hymen is broken, they're not a virgin and they're not suitable for marriage. Okay? I have a story on that one. Okay? Girl comes in, she goes, oh my God, that patient that I have in there, she just keeps saying her rosary over and over and over again.
Wow.
I was going, what do you mean? And I said, did you ask her if she's sexually active? Well, she's in her 50s, of course she would be. She was a nun. Nothing had ever penetrated her vagina until our technologist put a transducer up into the vagina.
She did?
She didn't ask her. And so she was praying for God to forgive her because she thought she was going to go to hell because there was something in her vagina.
So Ms. Shepherd, do they go and get
Never assume.
Do they go and get an exam to tell if the hymen is broken or not? Is that how they
No. Mm-mm. On the marriage bed, if there's blood, then
Yeah.
And there's even plastic surgeries that they can do now.
Yeah, to trick the guys
Yeah.
that they're not. They
There's
didn't have
actually
sexual-
plastic surgeries you can have
But
done.
they do that in Jerusalem.
I don't know. You're asking me a question, I don't know. Yeah, but there are actually plastic surgeries that you can do. Okay, so let's talk about the transperineal. I'm going to use this on someone. I'm going to look at their cervix, and they're already in the 3rd trimester. So I don't see the cervix because the baby's head's so low, I can't see anything. Okay, so I'm going to use it here. Never even learned this until I was out of ultrasound school. Okay. double glove it. That's the easiest way. Okay, double glove it. Okay. Gel. I'm gonna find my leading edge, okay? And I'm gonna lay it so I know where it's at, okay? Oop, sorry. Have to clean that mess up.
This is.
I usually wear a large glove. These are medium gloves. Okay, so now it's on. Oh, let me get my fingers out. And you're gonna stretch it. Take out all the bubbles. Okay, this is my leading edge. I'm gonna put gel on. I'm gonna put it in like I'm going inside the vagina, but I'm not going inside the vagina. I'm just getting it wet because sometimes it's dry, and then you have to go in between the labia. So I'll go up, down, up. So that way I make sure that the opening is wet, okay? Because if it's dry, then I'm gonna have air bubbles. And this is all I'm gonna do. I'm not gonna do a transverse. I'm just gonna do a sagittal, and I'm looking straight at the cervix. So that way I can take imaging of just the cervix. Did it get you? And that's called a translabial or transperineal, because that space between the vagina and the rectum is called a peritoneum. Okay, so whenever I have a baby and the baby's bigger than the opening of my vagina, they will cut that and give the baby some more space. And that cut, it also has a number attached to it. I'm just guessing, 1 through 5. 1, just a little bit of a cut. Number 5, it's all the way through my rectum. Okay, so when you take it off, and then you don't want to be careful because you don't want any juices to splash on you, and you throw it in a red bin.
Do you have to apply your pressure?
Huh?
Do you have to apply pressure?
Not very much, just enough to where I'm not going to have an air gap, because it's going to be black on either side if I have air. Okay, and I'm going to tell them I'm not going in the vagina, but I'm covering the opening. Translabial, empty bladder. Transperineal, just another name for translabial. You put gel, the glove, and then gel. Gel, the condom, and gel. Because if you don't, then you'll have air gaps, and it's going to send that ultrasound right back to the machine. It's not going to read anything. Now, when you remove these, I have my glove on. I'm going to pull it down, okay? And I'm going to take my glove just like I did, and then into a red thing, okay? Okay, let me clean this. Okay, then you wipe it down. I usually use the patient sheet or something, and then I take it and clean it. Let me go put this. Did I get it all?